give some closing remarks. I hope you enjoyed the dinner, the awards presentation, and the slideshow. I am so happy and proud to be here with you all tonight and to celebrate another year of working together. As I think about tonight's celebration, I feel that we are really celebrating the better impulses of our human nature. The impulse towards compassion, towards justice, towards love. We celebrate not only these impulses, but the actions that follow from these, and the consequences of those principled actions, the consequences that result in making concrete improvements in people's lives. As I reflect on tonight's awards, I can't help but feel that this has been an incredible year for our community, with unprecedented collaboration among many community organizations, local government, and healthcare providers to build greater access to quality, affordable healthcare for all and to strive for justice. This year's award recipients symbolize exactly the kind of action, collaboration, commitment, and leadership that it takes to make our community a healthy community for all. It has not happened easily or quickly, and we are not done, but we are undeniably on our way. There is a proverb that says, if you want to go fast, go alone. If you want to go far, go together. So we are going together, and it has taken a long time and a lot of work for us to be where we are now. I can look back on years and years of work that has led us to this moment, to where we are now. I think about the work that it took to create the County Public Health Department and how that led to the creation of the Child Dental Access Program for low-income county children. And I think about how in order to advance that work and grow it, many of us got together to form Smile Healthy. And then I think about the last year and how Smile Healthy provided the foundation for the new Promise Healthcare organization, which operates Francis Nelson Health Center and Smile Healthy Dental programs. I think about the years of work with our local hospitals, Provena Covenant, now Presence Covenant, and Carl. I think about our struggles to advocate for legislation to create new programs to help all people have access to quality, affordable health care. In my mind, it's like time-lapse photography, and I can see what was and what became what we have created. And I see that every step of the way it has taken actions, great and small, by individuals, workers and leaders inside and outside of organizations. But what are organizations, if not collections of individuals working toward a particular purpose? It takes leadership within organizations, the kind of leadership that we have celebrated tonight, to move the organizations to collaboration, to a vision of working together in ways that at times might seem at odds with the day-to-day purpose and goals of that organization. Moving us towards justice, towards more compassionate and caring community, comes down to the values, the vision, and the action of individuals. It comes down to those individuals working together in collective action. That is how we make things happen. It also takes continuity, hard work, and patience, and letting our better angels guide us. That is what will get us there. And as the proverb says, if we want to go far, we must go together. Now, I want to tell you about where we want to go over the next year. Of course, we want to continue to build on all that we together here have created so that we can care for all of our community members. Beyond that, we want to seize the opportunity of the full implementation of the Affordable Care Act, and we want to enroll thousands of our uninsured and underinsured and struggling community members in new affordable health insurance and Medicaid starting this October. On a personal note, I cannot tell you how badly I want to do this. After 16 years of this work, I can't wait for the moment that we get to start helping people get health insurance. I can't wait for the moment that we get to start bringing people in from out of the cold and give them a real passport to health care. I know it won't be perfect, and I know there will be problems along the way, and you'll hear more about those than you will about the successes. But I want to wrestle with those problems and work to make it better. That is so much more preferable than what we have had. Health reform and the phase that is about to begin in October, when people can start applying for health insurance and Medicaid through the health insurance marketplace, is the biggest social reform that our country has had in 40 years. It's not perfect, but it's a huge advance, and it will save the health and the lives of millions of people. Healthcare consumers will be applying to the federal government to become an official navigator. You can help. A navigator is an organization that helps do community education and outreach and actually helps people enroll in the health insurance that's available. You can help us by signing our petition to demonstrate community support for our application. The petition and other materials for how you can help are outside at our literature table. I want you all to stay tuned because it is going to take all of us doing our parts to help spread the word and let people know that health insurance will be available to them. Our other work will include the ongoing struggle to protect Social Security, Medicare, Medicaid, and veterans benefits on the national level. We have to stay vigilant and active on these issues. In justifying the cuts to these basic benefits, national leaders say that everyone must have skin in the game. That's how they justify proposing cuts. But they are asking for more than skin of the low income, the elderly, the disabled, and the veterans living on fixed incomes. They are asking for muscle, blood, and bone, and we have to resist this. When we raise taxes on the super rich or close loopholes on corporations, they don't die or become sick. But when we cut Social Security, veterans benefits, Medicare, and Medicaid, people live sick and some die sooner than they should have. This, my friends, is not skin in the game. This is life itself, and we must resist these cuts. The last struggle to which I want to bring your attention to tonight is the Fifth and Hill struggle about the Ameren toxic site. And my Fifth and Hill friends are out there. There was an article in the paper today. Check it out. Don't believe everything you read. Ameren's cleanup, which is almost complete, is far from comprehensive, and residents continue to suffer the consequences of toxic contamination. The article didn't mention this, but Ameren had bought 2 highly contaminated, formerly residential properties adjacent to their contaminated property. They promised us they would clean that up as part of their overall cleanup. Now, they and the Illinois EPA are saying, yeah, they don't know if they're going to do that after all. So please stay tuned and respond to our calls to action this spring and summer. We are now 5 years into this campaign, and we have a long way to go before justice is served. But as this evening has demonstrated, sustained efforts, not giving up, going together, that is how we go far. Continuing the work requires all kinds of support and involvement. Tonight, I want to make a special appeal to those of you who can to consider making a special contribution to our William Muller Sustaining Fund. There is a slip in your ad books for this. Bill loved healthcare consumers deeply and was always looking ahead and concerned about our financial future so we could be around for a long time to continue the work that matters. Please consider making a contribution in honor of Bill and in support of our organization. And please continue to do all the things that you do, big and small, that help make our organization and the communities you serve better. From the bottom of my heart, I thank you for your good works and for your support, and I look forward to the next 12 months. Good night, and thank you.